Should you wear a mask while eating? What do you guys think? Some people should, and that's the point of this video. I want to show you a few studies. We know that COVID-19 is connected with some complicating problems. In fact, if you got diabetes, we know that that's going to complicate COVID-19 if you catch it, because it causes metabolic dysfunction when you have diabetes. So what else does? Well, for the first time, they have identified obesity, which is a body mass index of over 28, as a risk factor independent of anything else. So if you're a little bit overweight, you are at risk. Now, what happens if you're morbidly obese? Then there is a tremendous increase in your chances of ending up on a ventilator. How much more? Well, here's baseline. Look what happens when your body mass index goes up just a little bit. And if it goes up more and more, the higher it goes, the more likely you're going to have bad things happen if you get this virus. We looked at risk factors for COVID-19 in 2019, and they found that having a BMI over 28, which is hardly anything, almost 6 times more complications with that. Now here's the interesting point. Let's look at America. Where is America's body mass index? Well, guess what? It's 29. So the average American is over the limit to be at risk for this virus. As well known, obesity represents a state of low-grade inflammation. And that low-grade inflammation is one of the reasons that if you get this virus, you have more problems with lung function. They also say that another thing besides inflammation and obesity is epicardial fat. What is that? That is fat located around the heart. Now, you're supposed to have a little bit, but the more weight you gain, the more fat you have around your heart, and the more likely that heart won't be able to keep functioning. We have identified 6 chronic problems that increase your risk for COVID-19. And let's look at what percentage of Americans over age 50 have those risks. Over half. And that percentage goes up as you get older. And a lot of people don't have one complication, they have 2 or 3 or 4 complications. So they give some very interesting advice here. I want you to hear this. The fight against COVID-19 will not be won with Clorox, Purell, mask, or anti-IL-6 drugs. The fight will only be won through a serious commitment to improve everyone's foundational metabolic health, starting with the lowest hanging evidence-based fruit, dietary and lifestyle intervention. Would you believe you're hearing this from medical journals today? They go on, consuming fresh, fiber-rich whole foods could serve to mitigate some of the overwhelming immune responses that appear to be compounded in patients with COVID-19 who have diabetes or obesity, and must be the central focus in any clinical recommendations made to patients or healthcare systems during this pandemic. They conclude with this. Thus, now more than ever, widespread access to healthy food should be a top priority, and individuals should be mindful of healthy eating habits to reduce susceptibility to long-term complications from COVID-19. If only there were a plan that helped people do that. And as we know there is, Amy didn't know I was going to put this picture up, but this is what happened to her during the pandemic. She started in January, and by June, she had lost 80 pounds. Now, what do you think happened to her risk for COVID-19 if she gets it for complications? Went down tremendously. Most of these problems can be reversed. For immune optimal function, I want you to eliminate excess body fat, and I'm saying any of it. Just being a body mass index over 28 puts you at risk. Get rid of that extra body fat. Follow the 7 systems plan to get there.